Okay, so we've got my buddy came back and she's telling me she has a boo-boo for about a week and a half to 2 weeks. We're gonna peel off some of these band-aids to see what's going on.
Well, that's the same. That's just a little red mark on there.
Yeah, I'm so sorry. Let me just look at everything, right?
Yeah.
So let's make sure what's going on here. So it's just a little red mark, like she's saying, because of the bunion,
Yeah.
creating a little bit of irritation. I'm not a fan of these band-aids because, as you can see, I had a hard time pulling it off.
Yeah.
And the skin could get irritated and you can get a boo-boo. You can get an ulceration. So we don't like that. We like something else, which we will talk about later. So in regards to this, there's nothing going on. Here, we had the tip of the toe removed because of an infection, I would say, what, 3 months ago? Maybe 4 months? So nonetheless, we're going to peel this off. So the middle toe, she has it wrapped. Let's see what's underneath it. She's saying it's about a week and a half, 2 weeks. She doesn't know. But the toe started with a callus.
Yeah.
So can you please zoom in from here? From this side, because it's stuck to it. And we usually always want to see what kind of discharge is on the bandage. So now this is what we have. We have a big callus formation, and we want to see how deep this little guy probes. So we take an instrument and we try to be gentle and see if this goes deeper into the toe. And so we're looking at it. We're trying to peel all of this off. And this stuff is coming out. So let's see. So the tendon's attached to the tips of the toes. So what we're going to do is culture it and clean all this out. Okay.
Good thing
Okay.
you called us, Doctor.
Thank you. The culturettes, which is, the first one is anaerobic, which is oxygen hating, and it's usually in a glass tube as such. And then the second one is aerobic, which is oxygen loving bacteria, common contaminants on the skin. The other one is usually common contaminants of the gut that comes down in the shower, down to open wounds, because the wounds act as a petri dish for growth. So trying to get this open. Now they have them differently, the way they package. So now this is the other culturette. And so we're going to clean this up. You guys can see. First we're just going to try to get our culturettes and go from there. Okay, so that's that. So we've got those. So now what I like to do is open up my tools, get myself ready, and stopper. We'll use different tools. Sometimes it's easier just to get a nipper and just go around it, because this is very, very hard. You can really slide off, cut your finger, cut them as well. So we'll just clip this off, this callus. This is a huge, huge callus. And so we got to take that all off, as you guys can see. And we'll see. That's just a callus, and see if there's anything exposed underneath it. So this is all off as one piece. And this is how big it is. It looks like a nail, doesn't it? That's big. That's big in comparison to my tool.
Yeah.
So that's very thick and very big. That's buildup of mechanical. So that's good news, is she's bleeding. That's very good that she has blood flow coming down. So that's good. So there's nothing underneath here, so that's a good sign. The nail is fairly long. Since we're here, might as well just clip that guy all the way.
I think all my nails need to be clipped.
Yeah, so that's done. So now we're gonna go to the bottom now. So we cleaned the top, as you guys can see, right? In comparison to before. So now let's clean the bottom. Let's see how the bottom looks like. And so I like this tool. Some people use knives called scalpels. And like I said, it's fine, but I usually polish it up with a blade. But this is, for me, it's much easier. So hopefully if some of the residents are watching, hopefully they can learn from this. Everybody has methods, but try to use the most efficient method, especially when you're in private practice or you have a lot of patients to take care of. If you're going to start cutting with a blade, like I said, cutting something that hard, you can easily slip and
Yeah.
okay, thank you. Okay, so now we debrided this toe. The good news is she has blood flow, which is very, very good in her situation. She had a huge callus, as you guys remember, right on the top.
Can I hold that?
Yeah, if you want to, but
Yeah.
just give me a second if you could. So we took the specimen, the cultures, and now we're investigating to make sure how deep this ulceration is. So we want to make sure to give it a classification in regards to depth. So then I bring my instruments.
That's from when I fell down.
This year?
Yeah.
So if I may, so I'm gonna do my instrument, and as I take my instrument right smack here, right down here, I'm hitting something solid, but furthermore it's being undermined. The tissue is undermined, so I can bring this in and you guys can see that this is going underneath. Right here, that's all bone. And that's why the toe is fairly large in comparison to its neighbor. Let's compare the girth. Let's compare the girth. And that's just a week and a half, according to her, to 2 weeks. So that will be, unfortunately, ending up with a tip amputation as well. So we'll keep you posted. Thank you. Bye-bye.